Thank you, Angana, for the kind introduction and invite. And I would like to thank and I'm really, I should put my appreciation for all the warriors who are putting a brave fight against the disease. I have been doing research in scleroderma for the last 15 years, and tadalafil was one of our discoveries which we presented in 2008. And I am sure a lot of people, a lot of you are taking tadalafil for your treatment. So, that's how my journey with scleroderma started. And today I will be speaking on osteoporosis in scleroderma. And so first I will say what is osteoporosis, and then I will say how to diagnose it and what is the relevance of osteoporosis in scleroderma. So let us see a 55. This is the typical case what we see. 55-year-old lady, post-menopausal, well active. But the problem was that she had a scleroderma, interstitial lung disease, and hypertension. She was active. She was doing things. Her interstitial lung disease was not restricting her day-to-day activity. Hope you can see my slides. Angana?
Yes,
yeah.
Yes,
Are they changing? Are they changing the slides?
Yes, sir.
Yeah, great. So previously she was active, but suddenly what happened? One day morning she fell down and she developed a hip fracture following a trivial fall. This is the story what we hear. May not be in scleroderma patients, but in whoever is elderly in her house, they fall in the bathroom, they develop a fracture of the hip. And once you put a scleroderma there, that is an additional risk factor. Sometimes scleroderma patients also present towards his fracture. What is osteoporosis? Osteo means bone, porosis means hole. So once this is a normal bone, you can see the normal bone is quite thick. If you cut the bone like this horizontally, you will see there are a lot of thick trabeculae which will hold on. If you look here, all the trabeculae are very thin. So the bone becomes porotic. If the bone becomes porotic, what happens? It will break fast. It doesn't have thickness, so it breaks fast. That is what is called osteoporosis. So osteoporosis means bones are thinner or bones are have more holes. Once bones have more holes, they are more likely to fracture. So osteoporosis is a disease which increases the risk of fracture. So osteoporosis usually leads on to fracture or make the people at high risk of fracture. But it is not that every fracture patient has osteoporosis. As you know, fracture can be because you are going in a motorbike, you had an accident, you develop a fracture. That is not osteoporosis. Somebody who has a cancer or something in the bone, they develop pathological process. That can be pathological fracture. It is not osteoporosis. Osteoporosis is usually happens once somebody develop a fracture without any trauma. They were standing and then they fell down. Then they develop a fracture. So it's a minor trauma or a trivial trauma. That is the time you should think whether this person is having osteoporosis or not. The most, where does, if the bone is osteoporotic, where do they fracture? They can fracture in wrist. They fell down, they develop a Colles fracture. Or it can, most common site where we see osteoporotic fracture is hip bone or in the spine. When they fell down, they develop a fracture in the back or the spine. So first question is, so a lot of you who are listening to this may think, how common is osteoporosis? I think it's a rare disease. The answer is no. If you look at the Indian data shows that osteoporosis is present in 35% of Indian population. If it is more than 50 years, around 1/3 of Indian population is having osteoporosis. Other 45% are having osteopenia. Osteopenia is slightly not that worse. I will tell you what is osteopenia and what is osteoporosis, what are the cutoff values in coming slides. But what we should understand from this is osteoporosis is a pretty common condition in our population. And estimates shows that in India, around 4 crore Indians are suffering from osteoporosis. 4 crore is a huge number. So it's not at all a rare disease. And if you look at the fractures, you will think the heart attack is more common, stroke is more common, breast cancer is most common. No. If you look at the fractures, you see the risk of osteoporosis fracture in 1 year is greater than the combined risk of heart attack, stroke, and breast cancer together. So it is not a very rare disease at all. It is much more common than the other diseases what we hear of. And the problem is that, see, somebody develops a hip fracture. So here you will think, okay, it's a fracture, you treat it, you go home well. That's what even the a lot of medical people think the same way. It's a fracture. The people get operated, they go home back. Why should we worry so much about it? People have very clearly shown that if you have a fracture, especially of hip, the chance of mortality is very high. Why? Let us take the elderly lady in any one of our homes, not elderly lady, 45-year-old, 50-year-old lady who does a hip fracture. Once they develop a hip fracture, there has to be a surgery has to be done. Bedridden for some time, they develop a venous thrombosis or clot in the vein, and infection, pneumonia, surgery, lot of stuff happens. And especially in scleroderma, once you have a fracture, you had it because the wound healing will be difficult. You have a surgery, that wound may not heal properly. Then post-surgery, there will be post-surgical complications. Already lung function is down. So if you have a fracture, that kind of issues come up. For example, a scleroderma patient has a fracture of the back. Already they are breathless, difficult to take breath. If they have a fracture, that difficulty will increase. So what I'm trying to say is, fracture is not as simple as what we think. It not only causes a lot of morbidity, but also it increases the risk. So whenever somebody develops a broken hip like this, we are not looking at a broken hip, but we are looking at a death sentence. So what we should understand is that somehow we need to prevent fractures like this. So why fractures happen? Because bones becomes osteoporotic and they fracture very easily. Osteoporosis is usually called the silent disease. What is a silent disease? Because bone loss occurs without any symptom. They won't have any symptoms. First sign, they won't have any bone pain. It cannot be detected just by looking at the X-ray. The first sign may be fracture due to the weakened bone. When the bone becomes weak, the bone fracture. And that may be the first sign of this osteoporosis. It may be a minor trauma. They fell down just from the bed, they fell down, or there was a minor slippage and the bone breaks suddenly. That is the first sign. So osteoporosis is not symptomatic until you have a fracture. So how do you assess? How do you diagnose? People don't have symptoms. So the major tool of the diagnosis of osteoporosis is this X-ray-like machine, which is called DEXA. Dual energy X-ray absorptiometry. It is something very, very similar to DEXA, very, very similar to X-ray, not much of radiation exposure. And what do you look at? Once you get a DEXA report, it will look like this. This is called T-score. You can see this. This is the DEXA report. It will look like this. And there will be some scores will be given here. T-score and Z-score. And most of the time we should look at, you can see here, T-score. And this score is what we should look at. Where should you do the T-score? At the spine and also in the hip. Why we should do that? Because these are the two common spaces, two common places where they fracture, people fracture. So osteoporosis happens in the spine and also in the neck of femur. This is called femur or hip bone. And what should you look at? You should look at the T-score. And when should you worry? See, I'm not going to details of the score. Always think of osteoporosis if your T-score is less than 2.5, less than minus 2.5, or it is 2.5 standard deviation less than the normal population. So if you have a score of less than minus 2.5, it is osteoporosis. If it is minus 1 to 2, minus 2.5, it is osteopenia. Osteopenia means, penic means lesser. There is slightly less bone mass. Osteoporosis means it is clearly porotic. So look at the T-score. And if T-score is less than minus 2.5, you have osteoporosis. So till now I told general overview what is osteoporosis. Now let us come to the scleroderma perspective. So how common is osteoporosis in scleroderma? If you look, this is a study from US. There are no studies available from our country. Very less data about this from all over the world. In scleroderma, if you look at the osteoporosis, the prevalence is 41%, meaning if you have 100 people, 41 of them will be osteoporotic. And if you look at the age, if you're less than 50, it is around 20%. But after 50, it is around 50%. So if you are younger, that is fine. The risk of osteoporosis is slightly less when compared to those who are above 50. But considering scleroderma patients who are now, most of our scleroderma patients are surviving for a long time because of the early diagnosis, osteoporosis is going to be a significant risk in coming years. So who are at risk? As I told you, elderly, above 50 years, they are at a higher risk. If you are a female, you are at a higher risk. If you are postmenopausal, you are at a higher risk, especially in scleroderma. Sometimes we give cyclophosphamide, the ovarian function deteriorates. They are at a higher risk because ovaries are extremely important. Ovarian hormones are extremely important for the bone health. So if you have taken cyclophosphamide, your ovarian function has come down very early in life. Ovary has stopped functioning. So you are at a higher risk of fracture. And any previous history of fracture, the risk of next fracture is higher. Or if your family history, somebody in the family had fracture in the past with a low trauma fracture, or your mother or father had a tendency to fracture, you are at a higher risk. So these are general risk factors. But what are scleroderma specific risk factors? If somebody has a scleroderma for longer duration, 10 years, 15 years, 20 years, they are at a higher risk of osteoporosis. Low body weight, very, very important. Why? Once you fall, if you have a lot of fat in your buttocks or in the hands or thigh, it will act as a protective force. But in these people, scleroderma patients, they don't have fat. So what happens? You fall, suddenly your bones directly hit the wall or the floor. Then what happens? They fracture. Not only that, these scleroderma patients, a lot of you have some kind of muscle weakness. So if muscles are weak, that will come to that in a couple of slides later. Interstitial lung disease, those who have interstitial lung disease, those who are treated with steroids for a long time, those who have a lot of GERD, gastroesophageal reflux disease, these people are prone to have increased risk of osteoporosis. So as I told you, osteoporosis is pretty common in scleroderma. You can see here, no, not new term, relatively new term. Sarcopenia means decrease in the muscle mass. In scleroderma, as all of you know, the muscle mass also comes down because of inactivity and other factors. Muscle mass also comes down. So osteoporosis, on one side, when we move, what do we need? We need muscles and we need bone. If muscles are weak, what will happen? Our strength will be less, and you are tend to fall down. Once you fall down, your bones are already weak, so it may fracture. So bone osteoporosis along with sarcopenia makes scleroderma people at a higher risk of fracture. So how do you assess fracture risk? This is a score which is available very easily online. It's called FRAX score, and there's an India specific score also available. So if you have FRAX score in India specific, you will get a value here. And depending on fracture risk, you can think whether I should get treated for osteoporosis or not. Majority of our patients who are young need not any, most of them less than 45 years or 40 years, may not have osteoporosis, so they don't require treatment. But if somebody is 50, 55 years and their T-score is less than 2.5, then they need to be treated. I don't want to go into details of when to treat and with what. So how do you treat? The first is lifestyle changes. Take a proper nutrition, take a lot of calcium, be physically very active, and try to avoid falls. That is the most important thing. Try to avoid falls. And if somebody is on steroids, have a most of the time it's a, if they are in higher dose of steroid, try to come down. You discuss with the doctor. Most of the doctors in India, all over, rheumatologists try to come down and stop the steroids in most of the patients, or they are on very, very minimal dose of steroids. Especially in scleroderma, the indication for steroids are very less. And if the lifestyle changes, nutrition doesn't work, is not effective, then that is the time you think of pharmacotherapy. So everybody, for example, any scleroderma patient, it is extremely important to have a proper nutrition, proper calcium. I will come to how to take increased calcium. Have a proper physical activity. Why physical activity is important? Because physical activity will increase the tone of your muscles, strength of your muscles. Also, it increases the blood supply to the bones, and bones will become stronger and stronger. So first and foremost is to optimize your vitamin D. I will come to that in coming slides. A second is adequate calcium. Take enough calcium so that your bones get strength. And last but not the least, as I told you, adequate exercise. At least in a week, try to walk for 3 to 4 hours. 3 to 4 hours. So per day, even if you can work 25 to 30 minutes, that will be great. and try to gain some weight. I understand that this is not easy, but try to maintain properly your nutrition. So C, D, E, F, G, S. You can see calcium, vitamin D, exercise, prevent falls. Extremely important. Try to gain some weight. And Indians usually, I don't think any of our scleroderma patients smoke. So stop smoking, especially if you have a tendency to smoke. In our center, or the 250 patients, none of them smoke. So in India, that's smoking is slightly less common when compared to the West. Calcium requirement per day. Again, if you ask me rule of thumb, how much calcium somebody should take, every female should take around 1 gram of calcium per day. 1 gram, 1000 milligram. That's what you can just roughly calculate, 1000 milligram. So whenever you take a food item, especially those properly packed food, there will be something which is given as percentage here, calcium 30%. What does this mean? This percentage daily value means, for example, what 100% of daily value calcium I told you is 1000 milligram. So if a food item contains 1000 milligram of calcium, that is 100% daily value. So, but this contains 30%. What does it mean? So this cup, sample size, so serving cup of 236 ml contains 30% of the required calcium for a day, or 300 milligram. So if you take 3 cups of this, more than enough. You have got enough calcium. The most important thing is, some people ask me, a lot of patients ask me, calcium supplement. If I take calcium, whether I will develop heart attack more? No. Calcium supplementations, no overdose. For example, if your requirement is 1 gram, another 1 gram calcium you take as tablets, then what happens? There is slightly increased risk of coronary artery heart disease. But usually with dietary calcium, the risk of increased risk of heart disease doesn't exist. So the best source of calcium is food, especially dairy products, green leafy vegetables. If you take fish, that's a very good source. So milk gives around 30% of daily value. 1 cup of milk per day will give you 1/3 of the calcium required. Ice cream, vanilla, they will give 8%. Yogurt and cheese are also again very good rich source of calcium. So if you take milk, yogurt, cheese, etc., you will get good amount of calcium. These are the other things. For example, cauliflower, spinach, cabbage, dates, all of them give good amount of calcium. Ragi, extremely useful. Ragi, if you take 330 milligram of ragi content in 100 milligram, it gives 32% of requirement of calcium. Soybean, again, very rich source. Urad dal has also rohu. There are so milk powdered skimmed. So I will just share this PowerPoint with the Scleroderma India group so that you can go through the RD. I don't want to go into details of each one of this. So few tips of calcium intake. Dietary calcium is the best. If you take calcium intake with food, it increases the 20 to 25% improved absorption of both food and supplemented calcium compared to empty stomach. So whenever you take a calcium tablet, take it with food. And night intake is better. Now, if you take calcium at night, that is better. And split dose, if you take calcium twice a day, from morning and evening. For example, if you want to take 1 gram, 500 in the morning or 500 in the evening. If you take 500, but the problem is you have to take 2 tablets. Sometimes it is difficult. So, but poor compliance. So to comply multiple tablets, already scleroderma patients will be on multiple tablets. On top of that, taking 1 more calcium is very difficult. So try to increase your food intake, or take food which has a lot of calcium. Another very important thing Neetu told me is to talk about is vitamin D. So vitamin D deficiency, very, very important thing. These are all rich source of vitamin D. Sunlight is the very rich source. Fish, non-vegetarian foods or milk, all these are very rich source of vitamin D. But problem is that most of us go to the sun with fully dressed, and vitamin D deficiency in Indian is more than 90 to 95%. If the vitamin D is checked in 95% who are not taking vitamin D tablets or supplements, the deficiency is around 90 to 95%. Now, when do you see somebody is vitamin D deficient? If the level of vitamin D is less than 25, it is called vitamin D deficiency. If it is 25 to 50, it is suboptimal. But if it is 50 to 75, it is adequate, and more than 75 is optimal. So what should you check at? You should check at 25 hydroxy vitamin D. Into a lab, if you walk, you ask for 25 hydroxy vitamin D and your is less than 25, it is vitamin D deficiency. If you ask me, out of 50 or 60 people who are in this group, more than 40 or 45 are going to be vitamin D deficient. So even if you don't check vitamin D, you can take vitamin D at least once a month. It is not going to cause overdose. So if you check vitamin D, well and good. If you don't check vitamin D, take vitamin D at least once a month. I take, most of the doctors take, because if you check vitamin D, most of our levels are very, very low. So not only vitamin D helps in bone health, as I told, it has some immunomodulatory effect. It helps the immune system. It decreases the risk of infection, and also it improves the muscle strength, and also it improves fatigue. So it has a lot of effect, vitamin D. How to take vitamin D? If deficient, if somebody has checked, vitamin D is less than 25, you can take one sachet of 60,000 units once a week, weekly, for a month. It is 20, it costs something around 15 to 20 rupees. Vitamin D sachet or vitamin D tablets are available at the tune of 60,000 units. Once a week, you can take for 1 month. And if you are, then continue for the 1 month, you raise the level by taking once a week for 4 weeks. After 4 weeks, you take once in 3 to 4 weeks. Around 3 to 4 weeks, if you keep taking, your levels will be maintained. But if you stop after 3 to 4 months, again the vitamin D levels will come down. So how can you check that? If you can, definitely you can have 400 to 500 rupees the cost of vitamin D test. So if you can check a vitamin D once a year during your routine blood test, that would be good. And you can adjust the vitamin D levels accordingly. I just want to touch upon how to treat this disease. There are 2 types of drugs which are available. One drugs which will inhibit the destruction of bone, other kind of drug which will improve the formation of bone. These are the 3 drugs: bisphosphonates and teriparatide and denosumab. These are the 3 drugs which are commonly used. Bisphosphonate is the most commonly used drug. The problem is that bisphosphonate can cause a lot of GI problems. Already scleroderma patients have a lot of GI issues. So try to avoid GI. If somebody has a lot of gastrointestinal issues, this bisphosphonates which are taken orally has to be avoided. There are IV bisphosphonates which are available, like which can be taken as injections, but they also have to be avoided when somebody's kidney function is low. So don't take bisphosphonates without consulting your doctor. Always consult your doctor before doing this. Teriparatide is another drug which is given as an injection, which also is usually useful in osteoporosis. So to summarize, osteoporosis is a silent killer or a silent disease. It is quite common in scleroderma. Osteoporosis, along with decrease in muscle mass, causes increased risk of fall and increased risk of fracture in scleroderma patients, especially those who are above 50 years. So what to do? Assess your bone mineral density. Who should assess? If you are more than 45 years or 50 years, if you are taking steroids, if you have history of fracture, then you should check your bone mineral density. And always, most important thing is lifestyle changes are very, very useful. Exercise regularly, walk, take adequate dietary calcium and adequate vitamin D. These 3 things will be enough for 70% or 80% of you. Another 10% of you who have fracture, who have low BMD, may require a pharmacotherapy, especially in the form of bisphosphonates or teriparatide, whatever, depending on your doctor's advice. So thank you for patient listening. Thank you for kind invite, and happy to take any questions. Thank you.